The province is changing the funding model that pays for some of Albertans' medical procedures. Premier Danielle Smith says switching to a system that encourages competition between facilities will ensure Albertans get better care for their money. Critics argue this is a move towards a two-tier healthcare system. Hogg has more.
Our government will not stop pushing forward to improve our healthcare system.
Premier Danielle Smith and her UCP government are making changes to the province's acute care payment plan that covers surgeries, cancer treatments, and emergency services. Alberta will switch from a blanket funding model to one that pays hospitals based on the number of procedures they provide.
Patient-focused funding is a powerful tool that can fully account for the complexity of care given to every patient.
The province says the new patient-focused model will standardize surgery costs and incentivize hospitals to be more efficient in providing acute care, because when they do, they will get more money from AHS.
We're creating the conditions for every administrator to figure out how to use the resources that they have to better use and be able to get rewarded with more dollars coming to the facility as a result.
Chris Galloway of Friends of Medicare fears this increased competition won't solve hospital staffing issues and could fundamentally change healthcare in Alberta.
If we don't have the workforce we need for a growing population, all we're going to do is create more and more of a two-tiered system where those with a bunch of money can pay to skip the lines and everyone else is looking around trying to find care.
They are more focused on what they like to call competition than they are on actually making sure people get good health care.
The opposition NDP voicing concerns that easier, quicker procedures will be prioritized.
We want to make sure that triage is based on those who are most in need, not those who can be treated the most quickly and out the door.
Adriana LaGrange says the province will take the time to make sure the new formula works for Albertans.
We're really going to be careful about this, but I'm already sure that a patient-focused funding model is the way forward for acute care budgeting in our province.
AHS is reviewing the best places to use the new approach, with patient-focused funding for select procedures across the system expected for 2026. Hogg, CTV News, Edmonton.